Hi, I'm Dr. David Hill, and today we're going to be talking about infant ear infection treatment. So first of all, let's talk about infant ear infections. Who gets them? Well, the good news here is that ear infections are really quite rare in infants who are not yet about 6 months old. They become much more common between the ages of about 9 months and 12 months and go on to increase in frequency until baby's about a year and a half old, and then they start to decrease in frequency again. So if your baby seems unusually fussy or sick and is not yet 6 months old, the chances that this is just ears is relatively low. Have a doctor get a look at your baby and see what else is going on. Let me say here too, if your baby is under 3 months of age and has a fever, that is never normal. That's never just an ear infection until proven otherwise. So have your baby evaluated immediately by a doctor if the rectal temperature is greater than 100.4 degrees Fahrenheit or 38.0 degrees Celsius. Now, if a baby does have an ear infection, what are we going to do? Sadly, still looking at antibiotics. I know a lot of people are like, do I really have to? Yeah, you really do in this age group. Now that changes when babies get to be about 2 years old. In 2-year-olds, it's perfectly acceptable to watch for a little while without antibiotics in a lot of cases and see if they get better on their own. But under age 2, we think that babies are a bit more susceptible to significant complications from the ear infection, and so we do want to use antibiotics. What kind of antibiotics? Well, we almost always start with amoxicillin. Why? It works well in about 90% of cases, and it's not a scorched earth antibiotic that's going to kill every bacteria under the sun and cause a lot of complications. So it's a good thing to start with. If, however, your baby also has an eye infection or an allergy to amoxicillin or has recently taken amoxicillin, such as in the last 30 days, your doctor may want to choose a different medication. Talking about how we treat ear infections in infants, I'm Dr. David Hill.